What if I told you that the very activity most people rely on to protect their knees after 65 may actually be incomplete? Walking is helpful, yes. Surgeons agree on that. But when it comes to protecting your knees from pain, stiffness, and long-term damage, walking alone is often not enough. This surprised even orthopedic surgeons when large mobility studies began to analyze why so many older adults who walk every day still develop knee pain, instability, and difficulty with stairs. The pattern was clear. Walking improves endurance, but it does not adequately strengthen the specific muscles that unload pressure from the knee joint. And after 65, that missing strength becomes critical. Research in orthopedic and geriatric medicine consistently shows that seniors who include targeted knee protective movements maintain joint stability longer, experience less pain, and delay or avoid surgical intervention compared to those who rely only on walking. In fact, many surgeons now recommend short, focused movement routines over longer walks for patients with knee concerns. Before we begin, take a moment to think about this. If walking alone truly protected the knees, then older adults who walk daily would not struggle to rise from a chair, would not feel knee weakness on stairs, and would not fear uneven ground. But these are some of the most common complaints orthopedic clinics hear every single day. That's why today I want to share 3 surgeon-approved movements that protect your knees better than walking alone after 65. These movements are gentle, joint-safe, and designed specifically to reduce stress on the knee while strengthening the muscles that support it. No jumping. No deep knee bending. No pain. Let's start with the first and most important movement. Movement number 3 is the chair sit to stand with control. Orthopedic surgeons often call this the foundation of knee health after 65. This simple movement trains the muscles that absorb load before it ever reaches your knee joint. Every time you stand up, your quadriceps, hips, and glute muscles should share the work. When these muscles weaken, the knee takes over and absorbs more force than it should. Walking does not retrain this pattern. Controlled sit-to-stand does. Here's how to do it safely. Sit on a sturdy chair with your feet shoulder-width apart. Your knees should be roughly aligned with your toes. Lean forward slightly from the hips. Slowly push through your heels and stand up, taking about 3 seconds to rise. Then lower yourself back down just as slowly, taking another 3 seconds. Do not drop into the chair. Start with 5 repetitions. Rest. Then repeat 1 more set. If you need your hands at first, use them lightly. Over time, your leg muscles will take over. Surgeons trust this movement because it reduces knee joint compression while strengthening the muscles that stabilize the knee. Within weeks, patients report less knee strain when standing, climbing stairs, and getting out of cars. Now let's move to movement number 2, heel raises with balance support. This may not look like a knee exercise, but it is one of the most important knee protective movements you can do after 65. Your calves and ankles play a major role in how force travels up your leg. When these muscles weaken, shock travels directly to the knees. Walking does not strengthen the calves enough to stop this process. To perform heel raises, stand behind a chair or near a wall. Lightly hold it for balance. Slowly lift your heels off the ground, rising onto your toes. Hold at the top for 2 seconds, then lower slowly for 3 seconds. Start with 8 repetitions and work up to 15. Focus on control, not height. This movement strengthens the calves and improves ankle stability, which reduces rotational stress on the knee. Surgeons often refer to the calves as shock absorbers for the knees. Strong calves mean smoother, safer movement with less knee irritation. Patients who practice heel raises consistently report improved stability, fewer knee flare-ups, and greater confidence walking on uneven surfaces. Now we come to movement number 1, the most underestimated knee protective exercise after 65. Standing hip abduction, also known as side leg lifts. One of the primary reasons knee pain worsens with age is weakness in the hip stabilizers, especially the muscles on the outside of the hips. When these muscles weaken, the knee collapses inward slightly with every step. Over time, this misalignment increases wear on the knee joint. Walking does not correct this problem. Side leg lifts do. Here's how to perform them safely. Stand next to a chair or wall for support. Keep your torso upright. Slowly lift one leg out to the side without leaning your body. Your toes should face forward, not upward. Lift only as high as comfortable. Hold for 1 second, then slowly return to the starting position. Perform 10 repetitions on one side, then switch legs. Do 2 sets per side if comfortable. This movement strengthens the muscles that keep your knee aligned properly during walking, standing, and stair climbing. Orthopedic surgeons emphasize this exercise because it reduces knee joint stress at the source, not after the damage is done. So why are these 3 movements better than walking alone for knee protection? Walking keeps you moving. These movements keep your knees aligned, supported, and protected. Walking improves circulation. These movements improve joint mechanics. Walking is beneficial, but strength and alignment are what preserve your knees. Think of walking as movement and these exercises as insurance. One without the other leaves your knees vulnerable. How often should you do them? 3 to 4 days per week is enough. Move slowly. Never push into pain. Most people notice improved knee comfort within 2 to 3 weeks. Within 2 months, daily tasks feel easier and more stable. Let me leave you with this important reminder. Knee pain is not an inevitable part of aging. In many cases, it's a sign that the right muscles are not doing their job. When you strengthen those muscles, the knees finally get the relief they've been waiting for. You are not too old. You are not too late. Your joints respond to the signals you give them. Walking sends one signal. These 3 movements send the ones your knees truly need. If you found this helpful, take a moment to like the video and subscribe for more surgeon-backed guidance on aging safely and confidently. And let me know in the comments which movement you're most excited to try. Your knees carry you through life. Protect them wisely.